Hi, I'm pleased to welcome Dr. Avis O'Connell, a breast imaging expert with the University of Rochester Medical Center, to the program. Doctor, we've chatted several times through the years. We have an important topic we want to get to today, and this is concerns about COVID vaccines and mammograms. What is the concern?
Well, in recent months, the breast imaging community has become aware of a side effect of the COVID vaccine in that lymph nodes on the site of the injection have become enlarged. And initially, when we saw that, it hadn't been well known that this was going to be a reasonably common side effect. So some folks did have additional imaging, because back before COVID, if one saw enlarged lymph nodes, there was a concern of malignancy, of cancer. But once we understood that the vaccine was causing the lymph nodes to be enlarged, we don't have that concern anymore.
So for people watching, what is your recommendation as it relates to this new information that we're learning about?
Well, the thing is, since the pandemic, we've had a lot of people delay or completely ignore their mammograms. We really strongly want people to get their routine mammograms, because we are looking for that other very important C disease called cancer. So what I want to tell everybody is, get your mammogram. So if you have a very good relationship with your imaging team and you phone up to say, I finally got my vaccine scheduled for next week, can you do my mammogram this week? If they say yes, well and good. My message is, if they say we can't reschedule you for months, just go and get the mammogram. Really do. Because we can deal with a slightly enlarged lymph node. We promise not to diagnose you as cancer unnecessarily. But it's so important to get the mammogram. People have delayed way too long.
Okay, so regardless of whether you've had the vaccine or not, don't hesitate getting the mammogram if you are overdue.
If you could, in a perfect world, get your mammogram the week before you got your vaccine, yes, then there'll be no problem. But this is not a perfect world, and mammograms are sometimes hard to reschedule. Get the mammogram. You tell the staff that you've had the vaccine, which arm it was in, and then we will take care of, most of the time, there's no reaction. Most of the time, the mammogram is normal and the lymph node is normal. But maybe 10%, maybe not even, the lymph node is slightly enlarged. And then we will call the person back, make sure that there's no hidden cancer in the breast. Most of the time there is not. And then we'll say in 6 to 8 weeks, we're going to recheck an ultrasound to relook at your lymph node. And they return to normal in 6 to 8 weeks.
All right, doctor. Got it. Really important advice for our viewers. As always, we appreciate your time. The Society of Breast Imaging has put out a paper with more information about this. We've been talking about it. We'll share a link to that on our site as well with this story at rochesterfirst.com.